and Tell, a podcast all about cats, hosted by me, Christina Wilson, certified cat behaviorist. Our guest today is Dr. Gina Rendon, DVM, Medical Director of Williamsburg Vets. Today we'll be talking about medical conditions and behavioral changes in cats, monitoring cat behavior, regular checkups and insurance, recognizing pain, behavioral issues and medications, and so much more. Let's get the podcast started. First of all, I guess I have to introduce you. This is so weird. I feel like so actory and weird, and I hate it. I hate it. Like, okay, how am I gonna?
Well, don't you first? You have to say this is the cat pod. You have to do your introduction, and I am, and you are.
Can't AI do this part for me? Just making a hour-long blooper reel of I don't know what I'm doing. Okay. Welcome to Hits and Tell. Today's guest is Dr. Gina Rendon, my favorite and best and smartest veterinarian in the whole world. That doesn't make any sense. You can't be my favorite, best, smartest veterinarian in the whole world, but that's what you are. She works at Williamsburg Vet Clinic in Williamsburg, Brooklyn, New York, USA, world, universe, etc. And she's here to talk to us today about all things cats. So, hi, Dr. Rendon.
Hi. Hello, Kristen. You can call me Gina. Yeah, call me Gina.
Thanks. So, Gina,
yes.
Why don't you tell us a little bit about your journey towards becoming a veterinarian?
Ooh, my journey. See, you gave me questions that I had kind of prepared for,
right.
And I didn't prepare for this stuff, but my journey actually wasn't as straightforward as some journeys are. I know a lot of people, a lot of veterinarians knew they wanted to be veterinarians when they were born. And I always loved animals, but I actually didn't go to school until a little bit later. So not until I was in my 20s did I go to college.
Mm-hmm.
And so I went to college, and I was very interested in learning about neuroscience, actually. And so I studied biology and got a minor in neuroscience. And so after I finished college, I then went to graduate school doing a neuroscience type of a thing. But I really did not want to do any animal research. And so I got into a human lab that studied memory and did that for a little while, but then realized as I was on that track that I really did not like doing research. And so I hated doing statistics. Math is awful.
I love statistics.
I hate statistics. So
I get it.
So after it seemed like you're just making little tiny incremental changes, to somebody's research. It just wasn't my thing. And so kind of after some soul searching, I realized what I really wanted to do. What I always wanted to do was work with animals. And so I decided to go to vet school. And so I didn't actually go to vet school until I was in my 30s. But it was definitely the right choice because I love it. I love being a vet. Full disclosure, now I've been a vet for, 20 years. And and again, I knew it was the right choice because I still love it.
Yeah. And I have to say that you're one of the very few vets that I have known and worked with for the past, I guess I don't think I've known you for 20 years, but once I started going to a certain vet in the East Village, most of those other vets that I loved and worked with, aside from one who I know is working with you at your practice now, have all either left the business entirely or gone on to do very different, although still animal associated things because the burnout is so real in the industry. And can you speak to that a little bit, or not really because your experience is so different, because I know you are the head of your clinic?
Yeah. I think it's different for everybody. I think for a long time, there was very much kind of a martyr approach to veterinary medicine. As far as the professions go, it's paid much less than some of the other professions. So paid much less than human doctors, much less than dentists. And so for the amount of work that you're doing, which is just as much, and for the amount of caring that you're doing, the financial incentive is not huge. And so I think that ends up being a little bit of it, that you feel like you're working and working, and you're putting so much emotional investment into everything that you do that it
Right.
really, I think that's what leads to burnout. Not to mention that our patients, the lifespan of an average dog and cat are it's short, so, you're not looking at decades of care. You're looking often at, 10 to 15 years if you're lucky. And I think that also really impacts the profession. It's really hard. There was the question about grief, which I thought was a
Yeah.
very good question. And I think a lot of vets have to deal with that. And then, the other aspect of it, I think for not necessarily on my case, but a lot of people are animal lovers and not necessarily human lovers. And so
Well, yeah.
you always have to deal with a human when you're dealing with a pet, somebody's beloved animal. And so I think for some people, it's not, they don't realize that you have to have that relationship as well. And I don't think that's as easy for everybody. So,
I
yeah.
totally understand. I guess I never thought about that, of course, in the veterinary profession, but doing behavior stuff and especially doing rescue stuff, we run into that
Hmm.
so often that people
Yeah.
who are drawn to work with animals often, and I'm not going to say this is in every case, obviously, but often are drawn to work with animals because they have some kind of trauma in their background that makes them
Hmm.
less interested in working with people, but still wanting to
Hmm.
work in a healing kind of profession or job.
Right.
And
Right.
often that trauma is unaddressed, and therefore it
Hmm.
makes it very difficult for them to deal with people, even though, even working in rescue,
Hmm.
we have to work with other people, we have to collaborate with
Hmm.
other rescuers, and it
Yeah.
very often becomes difficult
Yeah.
in terms
It's
of
challenging.
interpersonal stuff. There's a lot of drama, there's a lot of
Hmm.
infighting, which gets so goofy because really we're just all trying to work towards the same goal. And I think it's just there's
Right.
so much trauma that comes out, um, that I really wish there was a course for, like, hey, do you love animals? Here's how to work with people. Like,
Right.
here's how to
Yeah.
get what
Yeah.
you need
I
done.
think, yeah, I think that's now being recognized more. And so in terms of professional development, those types of classes are being offered a lot more to younger graduates, much more than when I, came out, there was nothing
Right,
like that. But now I think that's definitely the direction, which is really nice. And I
right.
think it's easier for the younger vets to just learn how to communicate because that really is the hardest part. So,
I
yeah.
agree, and I think younger generations obviously have less stigma around therapy and less stigma around
Hmm.
processing
Yeah.
whatever their issues are, and they're more open communicators. And I do think it's more of a problem of our generation and the generations before that. That I see a lot of that, and when I work, even up here in Connecticut, it's been wherever I work, especially
Hmm.
doing like feral and rescue and trapping stuff. That there's just such interpersonal drama. It's
Yeah. Yeah.
bonkers. It gets so bonkers, and
Yeah.
it's really sad. But I guess I never really thought about the spillover that would go into veterinary care as
Hmm.
well with those kinds of issues. So another question that I had is that, and I kind of piggybacks off what you just said, was like, how do you
Hmm.
balance the emotional demands of working with sick or injured animals while still providing such excellent care? Like, how do you compartmentalize that? Like, how do
Yeah.
you
I mean,
handle that?
yeah, there's a lot of compartmentalization. I mean, I think that's one of the things that you end up having to learn how to do because in the course of a day where you're seeing appointments, you may end up doing something like a euthanasia and then have to go right into your next appointment after that. And
Right.
you can't obviously go into your next appointment weeping, which
Yeah.
a lot of us feel like, that you have to kind of take a minute. But, for me, the way I deal with it is I think about how many animals I have helped. I've seen, luckily, I'll see patients that really are not doing well. And I've had enough cases that I've been able to turn around and see them doing really well and kind of exceeding expectations enough that it keeps me going. Obviously, there are the cases that don't do as well. Um, and, you lose patience and it's hard. But I think the other motivating factor is that a lot of the people, I mean, most of the people that you work with, they're doing things out of love for their animals, and that's what I find really sustaining is just supporting that bond between people and their animals, because I know how much I love mine, I know how much they mean to
Yeah.
me, and being able to see how that's true for other people is really, a big motivating factor for me.
Sure. But is there a cat, and we're going to just focus on cats because this is a cat podcast.
Sure.
But
Hmm.
can you tell me about a cat or cats that have made like a lasting impression on you personally, like through their personality or circumstances or resilience or like at whatever in your practice? Like, and you don't have to say any of our cats.
I don't have to. Steve does. Steve definitely stood out as, such a personality, such a big personality. And, the nice thing is that he's not the only cat that has stood out as having like this really great personality. He was always a little, tricky because he
He
always
was
gave me a
the
hard time.
worst. He was the worst. You can say it. He
Well,
was the
he
worst
wasn't
at the
he
vet.
wasn't
Like,
he wasn't a happy patient, but he was always
no.
happy, which is kind of funny.
Yeah, I
Um,
mean, he wasn't
no,
trying to hurt anybody. He just
no,
disagreed
never,
with
never.
everything
He
that
was
was,
very opinionated about everything. Yeah.
yeah,
Um, there have been actually, many cats that have that same just amazing personality. And I can't think of any specific one, other than Steve, but I think of my own kitties,
yeah,
the ones that I've owned and the ones that I have just loved so much have had such huge personalities. And, the interesting thing to me is about cats is I kind of feel like cats can be somewhat predictable in the things that they like, the things that they do, but their personalities are always so distinct. And, just from my own experience with my various kitties, they were so different in every way that that's kind of, one of the joys of them.
yeah.
They're fun. Yeah. Yeah.
Absolutely. I feel like Steve's people would love to know because they always are asking questions like this. Is have you noticed a pattern in terms of breed specific personalities?
The funny thing is that the different clinics that I've worked at, each clinic will have a certain story about a certain breed, which I find really funny. And then you go to the
Yeah,
next clinic. So, for example, that calicos are really mean and nasty. I think, and that's not, that they're harder to handle because they
right.
are so opinionated. So, calicos have a certain personality. Orange cats are always really laid back, and that's actually kind of true. I feel like orange cats do tend to be a little bit more laid back, but and uh, the sphinxes tend to be dog-like. They're very funny. They're very social and personable, and I've definitely found that to be true. So yeah, I think there are some breed specific personality traits, but then again, like I said, I always feel like when you really get to know them, their personalities are very, very distinct. So
Distinct, yeah. So do you think a
yeah,
lot of that
yeah.
is just confirmation bias? Because I had to do an interview with the Wildest, I think it was recently, about like orange cat behavior. There's this, it's a whole thing
Uh-huh.
now on TikTok and Instagram that everyone's like, look at my doofus orange cat. But
Right,
I do
right.
think there's such a confirmation bias that, like, of course, when you see orange cat behavior, you notice it
Hmm.
and
Hmm.
note it as
Right.
orange cat rather
Yeah,
than like noticing that in your other cats that are also being stupid.
exactly. Yeah, yeah, yeah.
Yeah.
No, I think that's
Just
definitely
to
true.
explain confirmation bias, although I'm sure everybody knows what confirmation bias is. How do you like unwind or de-stress out of work? Like, can you, considering how stressful your job
Yeah.
is?
I mean, for me, I work out regularly. So, I run and I swim, and I do find that that is really important for me. That if I don't get in some time where I'm doing something aerobic, where I can
Right.
just kind of not think about things and just let that tension off, then that's when I really start to feel the anxiety. So for me, that's a big anxiety reliever. But otherwise, just hanging out with the people I love, reading books, watching movies, spending time with my little dog,
Yeah.
yeah, yeah.
That's good. What are some misconceptions about cats or veterinary medicine that you would want to address or clarify for people? Are there any? I know this is also kind of like a doozy of a question. Yeah.
Misperceptions about cats. That I think the biggest misperception is that if they're acting like everything is normal, that they are normal.
Mm-hmm.
I think the biggest thing is making sure that they're being checked regularly because they will definitely not show you if they're sick until they're really sick. And
Right.
so that's one big doozy. And then what was the other part of that question?
and just misconceptions about veterinary medicine. But before you even answer
Oh,
that, can you tell everybody like how often cats should be checked? Like I know,
hmm,
through their ages, because I know when they
yeah.
get more senior, they should be checked more often.
Uh-huh. Yeah. The kittens have to go through a kitten series, so usually we're seeing them every 2 to 4 weeks until they're about 16 weeks old. So that one's easy. And kittens, they will definitely have their various things early, as you have known. They can have upper respiratory infections, they can get um, skin things. So you're kind of dealing with things a little bit early, GI things. But a healthy kitten or a healthy adult cat, once a year is typically enough. And the amazing thing is that a lot of cats aren't seen once a year. It's usually people will kind of wait five
Right.
years or 10 years, which no blame on anybody's part. I think it is that thing that they're going along and doing fine, and time passes, and it's really easy to kind of let that go. But being able to see a cat regularly on a yearly basis, keep track of their weight, keep track of their blood work. It's really nice to be able to follow blood work over time, because you will
Mm-hmm.
start to see trends that can give you an idea that something is happening. But then once they reach, their mature years, once they become geriatric, and so for cats, I kind of think of that as around 10-ish. For dogs, it's earlier, but for cats, they can live definitely longer. But around then, I recommend every 6 months.
Yeah.
And I think, people don't realize it, but because they age faster than we do, things do actually start to develop faster than they do for us. And so, if you think about like a year in the life of a cat, that's like several years in our life. And so things really can change pretty quickly. So it's good to keep an eye on things.
That's a really good point and something I never thought of.
Yeah.
Do you notice any correlation, and I don't know if you even have these data in your practice,
Hmm.
between people who have insurance bringing their pets in more regularly versus people who don't have insurance? Like, if having insurance is helpful to
Hmm.
people, if it makes it more cost effective to bring their pets in on a regular
Yeah.
basis?
It's always great when people have insurance, and it seems that cat people have insurance less often
Oh,
than dog people do, which I think is interesting. But I do think that the people who end up getting insurance tend to be more, um, they get to the vet pretty regularly. And
yeah,
I think it may be just a personality thing. If you're worried enough that you're going to get insurance, then you're also worried enough that you're going to bring your pet in regularly. Um,
fair.
and so, yeah, so and I think and I don't know the actual statistics of, whether those animals, um, you know, how they fare compared to those that don't have insurance. But I do know that the animals that are seen regularly, that you can catch things earlier, and then manage a disease at its earlier state rather than having to wait until something is full blown and an animal is compromised. So, yeah.
That makes sense. That would actually be an interesting study to do, to just like look at data, or even do like a citizen science thing to look at people like
Hmm.
who has insurance on their cats and who doesn't, and how frequently are you taking your cat to the vet. Although I do
Hmm.
think it would be similar to like who comes to see me and my behavior practice, that people
Hmm.
self-select, right,
Right. Yeah. Yeah.
into the pile of who is very observant, who
Hmm.
is on, I don't want to say like on the ball, but who's going every year for their yearly, like who, like you
Hmm.
said, like if you have
Right.
insurance, you're probably already like very much like, oh, it's been a
Hmm.
year, I've got to take in
We
so
better
and
do
so
this.
for
Uh-huh.
their
Yeah.
rabies, FELV, like all the stuff that we have to do.
Hmm.
But also then to see how does that animal progress over like a long period of time in terms of
Hmm.
their health, and like how do both sides kind of
Right.
end up.
Yeah. Yeah.
I don't know. Because generally, I see people who either are extremely observant, or now their cat is peeing on everything. And it's like, oh, I've tolerated this for 15 years, but now I'm going to come talk to you.
Right. It's
Right?
true. Yeah.
Yeah. So
Yeah.
it's
My cat
interesting.
has been vomiting for, yeah, for 2 months, but
Yeah.
right now I need to come in on emergency.
Yes.
Yeah.
Yes. It's
Yeah.
That's always
Yeah.
very interesting to me.
Me too. Me too.
Yeah.
Yeah.
So that kind of leads us into what are some common medical conditions or illnesses that would affect a cat's behavior?
That would affect their behavior.
Yes,
Everything
or
affects their behavior. Cats are
yeah,
full of crazy behavior for various reasons. Actually, it's
Yes.
interesting to me because I feel like one of the things that people really should observe with their cats is behavior. And so
Hmm.
sometimes something really, really subtle, like a cat starts sleeping in a different place, not necessarily that there's any vomiting, there's any diarrhea, there's just all of a sudden there's a change in their routine. That can be an
Yes.
indicator for a cat that something is going on. And so um, cats are subtle like that, like I said. But as far as common diseases in cats, it's pretty much anything that can affect humans. The most common diseases we see in young cats would be, like I said, the upper respiratory infections,
Hmm.
which they all seem to be exposed to viruses early on, and so then a lot of them will harbor caleci or herpes or some long-term virus that lays dormant, and then some stressful event will make those viruses reactivate. And so you can see recurrent episodes of things like upper respiratory infections. But we also see, I think we're seeing more these days is our allergies, just because last summer we had the wildfire issues,
Hmm.
the air quality is so poor. And cats are so sensitive to air quality. And so we see a lot of asthma, a lot of skin allergies, itching, and that can be either environmental allergies, it can be food allergies. In older cats, the things that we see are unfortunately kidney disease in cats, which I think is, I don't think we really know specifically why, but I kind of feel like it may be just the way cats hydrate. They're not
Mm.
really always so great at hydrating, and I think sometimes that makes their kidneys a little bit more um, fragile. But then also, cats can get hyperthyroid disease as they get older. Diabetes is not uncommon. And then there are like the lifestyle, obesity obviously is common in cats that are not very active.
Right.
And older cats, and actually for older animals in general, dogs and cats, the leading cause of death is cancer. And so obviously that's another one that early detection can be really helpful if you can find things before they progress.
Yeah. And to speak to your beginning point of this particular question about what are some signs, behavioral changes, and you mentioned sleeping in a different place. That was the first thing I noticed with Steve,
Isn't
that
that
something was
interesting?
off.
Yeah,
That he
yeah.
always slept with us and he started sleeping
Hmm.
on the couch in the TV room. And I do know
Hmm.
that our cats will change sleeping places seasonally, right? They'll
Hmm.
in the summer
Hmm.
they'll go sleep somewhere that's cooler. In the winter they're more
Hmm.
apt to or more they're more apt to sleep with us in the bed. But this wasn't a seasonal change, and it was just struck me somehow. I was like, that something isn't right,
Hmm.
and that's when his breath started smelling funny, and then that's when everything happened with his
Right.
squamous cell
Yeah.
carcinoma.
Yeah.
But that was the first sign, and I can see how it would be very easy for someone who is not super paranoid, as you know
Hmm.
I am,
Right.
to just be like, oh, he's just sleeping on the couch. Like, that's okay. He just wants some alone time,
Yeah.
like
Yeah.
whatever. But isolating and a new spot for sleeping is such, I think, such a big sign that
Yeah.
anytime I see any of our cats go sleep in a carrier, even though they love their carriers
Hmm.
because they're all carrier
Hmm.
trained, like I'm
Yeah.
always like,
Yeah.
oh no. And if it goes on for more than a day, I get really concerned.
Yeah.
Um,
Yeah. I mean, and I think that's something that you were talking about, people who are observant versus people who are not. And I think it's so important to get used to what your cat's behavior is like, to get to familiarize yourself or really just pay attention to the details of their life because
yeah,
it does tell you so much, like how much are they drinking, how much are they eating, where are they sleeping, what is their routine, because those
right.
little shifts can really be an indicator of something. It's interesting to me how many times I'll talk to somebody about, I'll ask about water intake, and somebody won't have even really noticed. And then it turns out the cat
Mm.
is diabetic. And if they're diabetic, they're drinking like mad,
So much water.
So
Yeah,
it's like so much water. So, I do, it is a good idea to just really pay attention because cats are hard.
I agree. And to that end, you know that I love to have cameras all over our house. Our house is,
Yes.
as my wife likes to say, it's like living in a surveillance state, but at cat level. I just put up like four more the other day because now we have our newest cat out and about, and so I just want to make sure everything's good. But also,
Uh-huh.
I really think on that list should be, especially if you have more than one cat, but even if you just have one cat, to monitor their restroom behavior, right?
Oh,
And
absolutely.
if you just
Yeah.
have one cat, you don't necessarily need a camera because you know everything that's in the box is from that cat. But because we
Uh-huh.
have 11 cats and we have multiple
Yeah.
different toileting areas, there is a camera in front of each toileting area so
Hmm.
that every night as I'm in bed, I can go through and make sure, oh, Uncle Dad went to the bathroom 3 times. That's his average because I also
Uh-huh.
ran
Yeah.
statistics because I'm a crazy person and I know who goes to the bathroom on average this many times, like who goes, and that's how I've caught
Hmm.
Kitten Man being blocked. I've caught,
Right.
multiple
Yep.
times things that I wouldn't have noticed otherwise because I'm not following them around all day
Right.
to
Right.
see what
Uh-huh.
they're doing.
Yeah. Yeah.
And it's very helpful, but again, I'm also paranoid. But I do really also recommend to people that they keep an eye on that because especially a
Absolutely.
blocked
Yeah.
male cat will
Hmm.
go downhill super quickly.
Yeah. And I think your point about multiple cats, it really does get complicated when there's more than one cat. And we've definitely seen that where, you'll ask somebody, are they using the litter box? And somebody is using the litter box, but they don't
Right.
know who. And so then that, just adds to the mystery of what's going on.
Yeah, I really wish, and I've been trying to talk to companies for a bit about making something that's like a litter robot that would have either a face recognition or an RFID chip in it that
Hmm.
would scan either the cat's microchip that's in their neck if you've had them microchipped
Hmm.
or just an RFID tag on their collar so that whenever a cat entered the litter box, it would note who went in, how long they were in there, what time, and what time they came out.
Hmm.
And then it would send you a little stats log at the end of the day, sort of like those Sure Pet bowls do. I think a combination of Sure Pet
Yeah.
and Litter
Yeah.
Robot would be amazing. So that then at the
Yeah.
end of the
Yeah.
day, I wouldn't be going through 4 cameras feeds for 24 hours. I
Right.
could just look at this
Right.
report and be like, oh, look,
Uh-huh.
Uncle Dad went to the
So,
bathroom three
yeah.
times. Kitten Man went twice. That's normal. Oh, but look, Babby went 7 times. Something's wrong. Let's take her to the
Yeah,
vet, right? It
something's
would be
up.
so
Right.
helpful.
Right.
I really want someone to come up with this. Please, if any company is listening to this, please make this. I will pay any amount of money for these litter boxes so I can stop looking at cats going to the bathroom on video. Please help me. So another question that I have for you is pain or discomfort affect a cat's behavior and like what signs should pet owners look out for? And I
Uh-huh.
know I've tried to teach people about the feline grimace scale and things like that, but I'm sure there's like things that you can add or just speak to that question in general.
It's interesting because, again, going back to the fact that cats are so good at hiding when something is going on.
Right.
Um, and I think that, again, being able to observe, like you said, I don't know that everybody is as good at kind of looking and seeing, is there a grimace? Is there a change how their facial tension is? But sometimes it can be really subtle. So, obviously, like a sprained leg, a cat limping, that can be really easy to see.
Right.
But sometimes it is something as subtle as they're sleeping a lot more. And so, whereas they would have a routine where, this is the time of the day where they go chase after whatever, or they go play, they go do whatever, go check on the window. When they're not doing that, and if they're just staying in one position, that can be a sign of pain. Interestingly, cats will do a lot of self-grooming when they're in pain. So, licking their abdomen if they actually have bladder pain is not uncommon, or if they have GI pain. So sometimes you'll think it's allergies, and it actually is discomfort. So those are things to look for. And then, of course, appetite. If they're not eating, then that can be a sign that things are off. So they can be really subtle signs.
Right.
And so, again, so important to just be able to kind of keep track of how they normally behave, because just a tiny change can be a big indicator.
I totally agree, and I just want to share anecdotally something that happened in our house recently. Is that Kevin and Kitten Man have both been really grieving Steve's death, and so they've both been
Hmm.
on fluoxetine, which is
Hmm.
Prozac for cats, and that has been really helpful. But then, like a month and a half ago, Kevin started kind of aggressing towards Kitten Man again, and I was like, "What the heck? Like, what's going
Hmm.
on?" But we've had all these foster cats in the house, so I was like, maybe it's
Hmm.
just the stress from all these additional animals that
Uh-huh.
aren't out in the house, but they can smell them, and that's probably not helping, contributing all these extra cat smells in the house.
Hmm.
But it was time for his yearly checkup anyway, so I took him in to the vet here, and it turns out that, and I was thinking maybe we need to increase his fluoxetine. He's on like a very low
Hmm.
dose, and it
Hmm.
turns out his stomatitis has inflamed his mouth again, and his
Ah.
mouth was
Hmm.
really, really red. And so we've upped his
His
steroid,
pred.
his pred. We
Uh-huh.
upped his pred, and then I'm also giving him a little bit of GABA in the morning, like just 50.
Okay.
Whereas he's such a
Hmm.
big boy, he could take 200 and probably wouldn't even notice
Right,
it.
right, right. I'm
But
sure.
he's back to his happy self. He's no longer being aggressive, and it was coming, I
Oh,
think,
good.
from pain. Like his mouth was
Yeah,
painful,
yeah. Hmm.
and so that aggression was a sign that I didn't think of as coming from pain. I thought that it was coming from emotion, and so
Hmm.
it was an important lesson for me to learn that
Yeah.
I need to also think of possible medical drivers, even though he seemed
Hmm.
like perfectly healthy.
Yeah,
So
I'm glad you brought that up because aggression it is actually a really, people who pet their cats on a regular basis and they love them, and then all of a sudden the cat is now turning around and swatting them, which can be, it hurts your feeling. You think you've done something, but that's a really, I think, a big flag. Is there
yeah,
something that's going on? Is there arthritis? Is there, some other pain? So that
right.
would definitely be a change in aggressive level, I think is a really good one.
Yeah.
Yeah.
And
Oh,
speaking
other
of,
things I guess I should also mention with older cats, because I think this is something that people also don't really think about, is their agility. Cats tend to be pretty agile pretty late in life, but sometimes you'll see cats that, as they stop jumping onto things, people don't really think of it as being a pain thing. They think of it as, oh, they're just getting older. And arthritis obviously is something in cats that's been unrecognized for a really long time. And I think only more recently, in the past several years, has it really been focused on. And so, just because your cat still is pretty flexible doesn't mean that they're not developing arthritis. So
right.
another thing to remember. Yeah.
Can you speak a little bit about the advancements in treatment for that, like Silencia and
Um, I'm still not thrilled with the options for cats. There's still not a lot of great options because they are
yeah.
more sensitive. There still are the non-steroidal anti-inflammatories on the market. So meloxicam
Mhm.
is an NSAID that there's a lot of controversy, and I think a lot of that controversy is because of how it was originally used, which was in really high doses and really impacting kidney function in these cats that were on it. But something that can still be a really excellent pain option for cats if you use it right. There's meloxicam or Onsior. Onsior is harder because you don't it's like pills in threes. You can't get more than that. It's not a
Right.
bottle full, but Silencia is a nice option. Have you had any experience with it? Have any of your cats had it?
No about it.
Yeah, yeah. The nice thing about the Silencia is that it's so safe. It's a monoclonal antibody that targets a nerve growth factor, which is what causes pain and arthritis. And so it specifically targets that. It's not metabolized through the liver or the kidneys. It tends to be very safe. It seems that you have to use it more frequently to see, the full blown effects. So one shot's probably not going to do it. You just have to
Hmm.
do it on a monthly basis. And for people who don't know, it's an injectable that's once a month. The nice thing is that there's not a downside to it. My clinic participated in a trial uh, where we had cats enrolled to get repeated injections. And I would say almost all of them improved, but not all of them did. So
Right.
there is a subset of cats that won't improve with that. And then Antanol is a very concentrated fatty acid that's made from green-lipped mussel, which cats tend to process that better as an anti-inflammatory than they do the glucosamines. So glucosamines don't tend to be that effective in cats. But omega fatty acids tend to be really good, and that's a really good one.
Yeah, I've had Mimi on that for the past few months, and she is tearing it up around the house.
The nice thing is that it's also good for skin health, heart
Hmm.
health. Like there's no downside to it, and it's such an easy little thing to give. So I really like that product. Yeah.
Yeah. Well, easy as if pilling a cat is easy. Actually, I think we talked about like, are there recent advancements or treatments in veterinary behavior that might benefit cats with behavioral issues?
That's a good question. I think you should know the answer to that as a behaviorist.
I
Do you
do,
have
but
anything
I
to tell
can't.
me?
There's anything super recent except that more and more people are open to giving their cats fluoxetine, which I think is
Yeah.
super helpful. And
Uh-huh.
hopefully, practitioners are moving away from kind of just doping cats up with GABA for
Hmm.
behavioral issues, because that's not working in the brain as the same way as
Hmm.
fluoxetine, which is Prozac is.
Hmm.
And I like to recommend the fluoxetine for really high stress, high anxiety cases
Yeah.
where cats are
Hmm.
over their threshold, and behavior modification alone is not going to be helpful because those cats are
Hmm.
so high stress that you can do all the
Yeah.
behavioral mods you want. You can do
And
all the clicker
it won't
training.
stick.
It's not going to
Yeah.
stick because they're operating at such a
Hmm.
high anxiety loop that first we need to bring
Yeah.
them down to a place that's workable. We can work with them
Hmm.
and then we can ease them off the medication. And it doesn't have to be something
Hmm.
that they're on forever. Just like with Kevin and Kitten Man, I don't plan for them to be on it forever. We're just easing
Hmm.
them through this grief transition. So that tends to be something that I work with vets a lot
Uh-huh.
with in my practice, to just kind of deal with clients, and help them get their cats through like a super high anxiety period, because generally I
Hmm.
don't see people until their cat is really presenting at a high level of
Right.
anxiety already
Right.
and being
Yeah.
destructive or
Yeah.
hiding or peeing everywhere.
Hmm.
And
Yeah.
they're at such a high point that whatever we do, they're not going to respond. um,
Hmm.
and the fact that you
Unless you
can,
have
unless
medication.
there's
Yeah.
medication on board, and the fact that you can compound it so that it's just that transdermal ointment that you can just put in the ear, so you again
Hmm.
don't have to
Super
chase the cat
easy.
around to
Yeah.
pill them. I think that's super helpful.
Yeah. Yeah.
But other than that, I don't know that there's a whole lot on in terms of pharmacology. That would be something that you would
Yeah.
speak to.
Yeah, not there. There isn't really, and again, I always feel like cats tend to be the forgotten animal, which is crazy because how
Right.
many cats are out there
I
and how
know.
much people are very dedicated. I think what's hard about them is that they are so sensitive. Um, so they tend to process medications differently, and so I it's probably just a the drug companies don't want to spend the money on what they think of as just a subset of the pet population. Yeah.
I think probably you're right, and that the spend on cats is so much lower than on dogs because
Hmm.
people generally just tend to think like cats are okay until they're
Yeah.
not. Like they
Right.
don't,
Yep.
because they are viewed as being so independent, even though they're not.
Hmm.
They
That's right.
need just as
Yep.
much interaction and love and affection and intellectual stimulation from people
Hmm.
as dogs do. But because they are socialized in such a different way, and I think people forget that we socialized dogs to
Hmm.
us to be kind of our
Hmm.
mirrors, and that cats domesticated themselves, rather, is what I was looking to
Uh-huh.
say. That they're 180 from us. And that's often what I
Yeah.
tell
Yeah.
clients is that whatever seems reasonable to you, like in terms of behavioral modification, what would work on you, you should do 180 of that because that's what's going to make sense to a cat, right? Like,
Uh-huh. Right.
because their brains are just so different that people just think they're fine, and that
Right. Right. Yeah.
they don't need much when in fact they need just as much. um,
Yeah. Absolutely. I agree.
so
Absolutely.
I have a feeling it's just not worth it for a lot of companies to put a lot of money into cats because people aren't putting that much money into their cats yet, and hopefully that's going to change as we do more and more
Yeah,
education and
I do feel like that's changing. Yeah,
yeah.
which is nice. I do feel like there's more of an awareness of how much cats need. But I agree. I feel like it's been for a really long time, cats are self-sufficient. They can, it goes to the thing that drives me nuts when people go on vacation and they leave their cats alone. I hate
I
that.
know.
I just,
I
it makes me
know.
so sad. Yeah. So, but I think that's changing. I think that people are really realizing the emotional lives of cats. They need a lot more than than just a window in the, a window seat or whatever, a nice bed. They need a lot more than that. So.
So, follower questions. Okay, so the first one is, do you have any tips for getting two cats into carriers with minimal stress and tears? I could give my answer to that, but let's hear your answer, and then if I feel like there's anything to add from a behavior
Yeah,
standpoint.
well, I'm sure we could both contribute, and I think we probably both agree that one of the most important things is that they're familiar with the carrier before the day they go to the vet or the day that you try to put them in. So I recommend having the carriers be part of their normal lives,
Mm-hmm.
places that they're used to spending time, that they get fed in, that they get treats in, they get toys in, so that it's not unfamiliar, which I think is so important. And also I think it's much more comforting when they do have to go to the vet if they're in a place that to them is something that is a safe place,
Mm-hmm.
as opposed to I'm only in this horrible little container when I'm going to the vet. I hate it. I hate you. I hate everything. You want to kind of make it a safe place for them, and then it makes the entire experience a lot better. But one of the things that is a little bit of I think you have to be careful about trying to get two animals into one carrier.
Mm-hmm.
Sometimes the visit to the vet can be very stimulating to a cat. And in some cases, it can make them aggressive to, even if it's their sister, their brother, their mother.
Right.
For whatever reason, some cats will get set off by that. And so it makes me a little bit nervous when I have two cats coming in the same carrier, because sometimes you'll put one in and the other one is already hissing and acting aggressive, and that makes me really nervous.
Yeah, then
So
you get redirected aggression.
you get that redirected
Yeah.
aggression, and that can actually continue on at home for a little while, which
Yes.
is never a good thing. So my preference is to have kitties in separate carriers for that reason.
Sure, and that makes
And then it
sense.
makes it easier. It makes it easier to load them too. Again, if it's a place that it's not too stressful to them and they're used to being in it, then that makes it a lot easier.
Right. Can you speak a little bit about pharmacological interventions, such as the ones I have to
Oh,
use?
and that
Yes.
actually, there's I think another question that's down the line, because you sent me that
Okay.
list of questions, and
Yes.
and the question was the pros and cons of having to take your cat to the vet when it's so
Yes.
stressful.
Right.
And I think this goes exactly to what you're referring to, which is that you should work with a vet who is cat friendly certified or fear free
Mm-hmm.
certified, that understands that sometimes a pharmacological intervention, and not even sometimes, I feel like for a vast majority of cats, they would benefit from being on either something like gabapentin or trazodone prior to going anywhere that's not their usual place.
Mm-hmm.
And so, vets can prescribe medications ahead of time. Usually, you need to have a relationship with the vet. There should be a doctor patient relationship before that prescription originally gets filled. Kind of depends on the doctor that you're working with. I have definitely prescribed like a day's worth of a sedative before meeting the patient in order to make it easier to get that patient in.
Mm-hmm.
Otherwise, it's a wasted visit if I can't actually see them. So,
Sure.
uh, yeah, and so but giving those medications a couple of hours before taking them to the vet will also make it easier to get them into the carrier. And it does make a huge difference in terms of their yearly visits, being able to get them in on a more regular basis.
Right. Can you, really for my edification, talk about the difference between gabapentin and trazodone?
Gabapentin is actually a pain medication, and it's great for neurological pain, but it also provides sedation. So, and the interesting thing about gabapentin is that we don't really know how it works. If you look at what the pharmacodynamics of it, it's not incredibly well understood what it's doing.
Mm-hmm.
But it is a pain medication. It gives you a little bit of sedation, whereas trazodone is an actual sedative. Oh my gosh, and I'm forgetting exactly how it works, but I believe it's a serotonin reuptake inhibitor to some degree. And so it actually kind of changes more their brain chemistry than acts as just a sedative.
Right.
Personally, my own experience with it is I feel like trazodone works a little bit better than the gabapentin does. I feel like gabapentin makes them a little bit sleepy, but when you if you stimulate them enough, they can fight through it a lot more.
Yeah.
Whereas the trazodone, I just feel like it really kind of gives them um, a little peace. So
Yes.
yeah.
That is my feeling as well. But with some of our cats, like Mimi, she's gonna fight through it no matter what it is.
Yes, some cats need both of those at the same time, which is also very safe. And I think that's one of the things too, is that these medications are very safe.
Yes.
And so, and animals is true, cats of both cats and dogs, they respond differently. So the dosing range tends to be very, very wide.
Mm-hmm.
And some animals respond to much smaller doses, whereas other animals need much higher doses, like Miss Mimi. So
Yeah.
yeah, but definitely something to work with your vet about on
Okay.
whatever.
And kind of taking that question into the next one is what is the best way to treat cat travel anxiety that causes car sickness? And this is from someone whose cat barfs 2 minutes into the ride. And I have had
Uh-huh.
similar cats who emergency poop 2 minutes into the ride. Like,
Yeah,
is that a
yeah.
similar scenario where we want to use medication?
Serenia.
Serenia, yes.
Yeah, I was going to say probably a combination. So if it's a stress thing,
Mm-hmm.
then I would do the trazodone because I really like trazodone for traveling cats. And Serenia is a motion sickness medication. It is off label for cats, so it's only FDA approved in dogs, but it works in cats, and we've been using it for years in cats. So I would definitely use that if you have a cat that gets car sick.
Okay.
Um, and that usually has to be given a couple of hours before travel to make it effective. So you have to kind of plan your day, but it can be very, very effective.
Thank you. um, How do you feel about homeopathic herbal care for cats? Is it real? Is it not real? Like, what's going on?
Yeah, it's a big question because I think there definitely are, homeopathic treatments that can be very effective. It kind of, you know, and a caveat: I really don't have training in homeopathic medicine, and
Yeah.
there are definitely doctors who take the time to, study for a couple of years and get certified in homeopathic medicine. And I don't doubt that there are benefits. I just don't really know what the specifics are.
Right.
Um, I think if you're interested in doing homeopathic medicine, you really should work with somebody who's um, done advanced training, um, because I'm sure there are things to offer. I just honestly, I don't really know that much about it.
Totally
But
fair.
like things like acupuncture for sure. I know,
Mm-hmm.
the nice thing about acupuncture is that you can't really do the placebo type of effect in animals the way you can with humans.
Right.
And we have seen differences made with acupuncture. But yeah, I'm sure there's some benefit. I just can't really speak to specifics.
If someone wanted to go to a vet who does have homeopathic training, what would they look for? Is there like a board certification? Is there.
Yeah,
Okay.
there's I believe the one the Chi Institute does, I believe, certification. And there are a lot of vets that have their Western doctorate, and then they go
Mm-hmm.
on to do additional training in herbal medicine. So I would look for somebody like that.
Okay. Cool.
Yeah.
Do you need to clip indoor cat's nails?
I think you do, because those nails will really, really grow. And I mean, if you have the scratching posts and the various things for cats, the only thing that does is make those nails sharper.
Yeah.
And
Yeah, I
so it's not,
know.
I mean, they take out those outer sheaths and it really,
Right.
it's great for their muscles and everything, but man, those nails are crazy. And one of the reasons I do think it's important to clip indoor cats' nails is because, for one thing, it hurts you when they're lying on you, and if they're making biscuits on your lap,
Yes.
it hurts. But they also can get caught in things, and
Mm-hmm.
so they get caught in fabric. And older cats can have those nails overgrow into their pads. And so if they're not used to being clipped, if you can't get a hold of them, then that can actually be a big issue. I've seen a lot of older kitty cats that have had several nails that are embedded into their
Oh,
pads, and it's awful. It's really
oh
awful.
my
So it's, I think,
gosh.
important to keep an
Yes.
eye, yeah, keep an eye on the nails and keep them from overgrowing.
Here is another question. My blind since birth kitten has nightmares. It's very scary for all of us. What should I do?
When I saw that question, I had more questions
Yeah, as
because
do I.
yeah, because I would really want to know what's happening.
Hmm.
Cats will dream, so you can see some motion in while they're sleeping. That's part of just dreaming.
Hmm.
Cats can also have seizures when what it looks like dreaming, which are actually little mini partial seizures. So it's possible that it's not necessarily nightmares, but maybe neurological activity, in which case doing something like an anticonvulsant can help. So I guess I just have more questions about what it means for the cat to be having nightmares. If the cat is painful, then obviously pain medications would be something to consider. But that was a I wasn't 100% sure what that meant.
Yeah, I think video would be helpful in this instance.
I think video would be very, very helpful. Yeah.
Yeah. Okay. Since my cat died, his non-bio brother has been obsessed with being brushed 3 to 5 times a day. Is he okay?
He's probably grieving, my guess is, and I think probably, Christina, you could probably speak to this a lot more than I can, having recently gone through this and seeing your cats that are having to deal with this change. But my guess is that, probably your kitty needs a little bit more affection because it's uncertain and things have changed and it's feeling confused and yeah.
Yeah, that was my read as well, and also that if they were very close, they probably did allo grooming, right? And so that
Hmm.
the cat
Hmm.
is probably missing that from his brother.
Hmm.
But also, I think being brushed is comforting. At least our cats, when I bring the brush out, because we do what I call salon Sundays. So every Sunday, everyone gets their nails trimmed and they all get a thorough brushing.
Hmm.
And, you know, and it's just the alliteration
Uh-huh.
makes me able to remember, like, Sunday, we got to do everyone's Tootsies and we're
It's
going to
the
brush
lawn
everyone.
today.
Yeah,
I
like,
love
if
that.
everyone has a
Uh-huh.
mat, they're going to get it trimmed out. You know, like, everything's taken care of. And whenever I bring that brush out, there's a literal line of cats. They will line
Hmm.
up because they love being brushed so much because it's a bonding activity, but it feels good, you
Yeah.
know,
Yeah.
and it is stimulating. It helps the blood flow, and you know,
Hmm.
I think all of that. I can't imagine an instance why being brushed 3 to 5 times a day would be bad.
Right.
I do think that cat is just grieving, and I think
Hmm.
any additional attention, intellectual stimulation, environmental stimulation, you
Hmm.
know, things like an enrichment box, a bird feeder for him to watch, like any of those
Hmm.
things can be helpful to help keep his mind out of the grief loop. But
Yeah. And one would assume that with time that'll be something that starts to normalize a little bit more. But yeah, I agree. It's important to recognize that, and I think to just to help him through.
yeah, and so that leads me into the last follower question, which is how do vets cope with grief? And I know that's like a big loaded question
That's a
that
big loaded
you and I
question.
have talked
Yeah.
a lot about, and I guess you
Yeah.
can
Yeah.
give whatever thoughts that you would feel comfortable sharing.
I think, one of the ways I tend to think of grief, and I do want to, whoever asked the question, I appreciate that there's a recognition that vets do really have to deal with grief a lot. I think it's important for vets to kind of grapple with it and figure out ways to deal with it because it is so real. Um, Interestingly enough, I think my daughter helped me with this more than anything is kind of looking at grief as the other side of love. That without that love, you can't have that grief. And so thinking of it in terms of like, you are so lucky to be able to have that love that you have. Unfortunately, that grief really does hurt, but it's also coming from that place of, you just had this really special bond and kind of honoring it as that, honoring it as the love in your life. Uh, it doesn't make it easier, but to me, it makes it a little bit more, it's a little bit more sacred.
Yeah, One of my oldest and best friends told me something very similar when Steve died, and it was just like, it's the grief is the price you pay. Like, you just pay at the
Hmm.
end, for all of
Yeah.
the joy
Yeah.
you had, and it's just, you just have to pay at the end. And it's
Yeah.
very,
You
very
pay at the end.
true,
That's right.
but it's rough.
Yeah.
So,
It is. It's really rough, but it's, I think just life in general, you have the good side and you have the bad side. Um, and it's what makes life rich. And so it doesn't make it easy, but I think it's part of it, and just kind of accepting that, and going back to thinking about how lucky you are to be able to have that love in your life. That's the way I deal with
thank you so much, Gina. That actually leads us into the
it.
next topic of the next podcast is going to be grief and loss. So
Okay.
let's wrap up on this depressing note. We can talk about the next episode. It's going to be all about
Wow.
handling grief and loss of a pet, and we'll be talking to some experts in that field. Thank you so, so much, Gina. You remain the
Oh,
absolute best, smartest, most wonderful vet in the whole
oh,
world. I've recommended you to people not on this continent, and just been like, well, the best vet is in Brooklyn. So,
oh,
you really are the most up on your education, kindest, nicest person, and we just appreciate you so much. And I
oh,
thank you
thank
so
you.
much for being a guest on my goofy podcast where I don't know what I'm doing.
But still so
Everything.
fun. Yeah.
Thanks for watching. Hiss and Tell is a subsidiary of my cat behavior business, Cattitude Adjustment, and that's our channel name on YouTube, which is where you've watched this video most likely. If you'd like to engage my services as a cat behaviorist, you can find me at cattitude-adjustment.com. Music is generously provided by Cat Beats.